Welcome back to Unapologetically Crunchy. Welcome to our first video podcast. So today we're joined by Dana Carretta-Stein. She is a certified EMDR therapist and a licensed mental health counselor. You may know her from Instagram as the EMDR coach, and she's also the founder of Peaceful Living Mental Health Counseling in Scarsdale, New York, where she's built a thriving group practice specializing in EMDR therapy and trauma-informed care. As an EMDRIA approved consultant, Dana also supports other therapists, helping them grow their confidence with EMDR and navigate their most complex cases. She's not only a total rock star in the EMDR world, guys. She's also a wife and she's a mother, and we are so thrilled to have her on the show today. Some of the things we're diving into today are what EMDR actually is and the science behind it, how EMDR helps people heal, and children too, which is very interesting to me, how to find the right EMDR therapist, the surprising role of dreams in the EMDR healing process, and we tackle some of the common misconceptions surrounding EMDR with a little game of truth or false. You'll also learn in this episode that I did EMDR myself, and that is what prompted us to reach out to an expert in the field to share some information about this. This has been a really positive experience for me through my healing journey, and so of course, anything that helps us, we want to share with you guys just in case it can help someone else too. So sit back, relax, and enjoy the show. So welcome to the show, and thank you so much
for having
being
me.
here.
Thank you.
Okay, so let's start off with finding out a little bit about how you got into EMDR and therapy.
Yeah, for sure. So I graduated from grad school 2011, and then so I did like my internship and all that, and then started in private practice in 2013 with my mentor Barbara Heffernan. And when I started in private practice, it was a brand new like baby therapist, and she was like, "You should try the EMDR training." And I, was, what is that? I've never even heard of it. They didn't teach about it in grad school. It wasn't something that was, known about at that time. So I was like, okay, yeah, sure. Signed up for the training and fell in love with it. It was because I was like brand new as like a newbie therapist. I didn't really get too ingrained in any therapeutic orientation yet. So I was really like a clean slate to build upon.
Mm-hmm.
And so when I did the training, I really took to it. It really made sense to me because it was, kind of look at the whole person and not just focusing on their symptoms. So, yeah, I did the training and then the rest is kind of history.
I love
Here we are
that.
12 years later.
Yes,
Oh, that's
and
great.
that's one of the things that I love about EMDR too, is how it really gets to the root cause
Right.
and focusing on the symptoms rather than, not that any other type of therapy does, but just like in general, just trying to cover things up or anything like that. I love
Right,
that.
right. It's like putting a Band-Aid on it versus like actually like figuring out what's going on.
Right,
Right.
exactly. Yes. That's
Yeah.
we always say, like in this show, throughout all of our episodes, it's always comes up about the root cause and how important it is to find that, which I
Yes,
love.
absolutely. And that's something I'm so passionate about too, because that's how you really heal. Like
Right. Yeah.
you can
We don't
manage a
want things.
symptom or you can heal it.
Right, exactly.
Mhm.
Okay, and so that all brought you to open up your practice, Peaceful
Yes.
Living.
Yep. So I opened Peaceful Living, which is named after my dad. So my dad was Philip Lewis. So Peaceful Living, I took his initials and put that into the name of the practice because I really wanted to
Very
do
cool.
something that honored him. He's
Yeah.
a very big force in my life. And he passed away in 2015. So how
Oh,
things kind of lined up where I always knew I wanted to have my own private practice, even when I was in grad school. So when it was time to do that, I really was very intentional with what I wanted to name it because I wanted it to have something that has meaning. And so I named it after him with his initials. And I started that in 2015. And you learn a lot from, not just being a therapist, but being a business owner and
right.
the ups and downs that are associated with that. And here we are 10 years later. We just had our 10-year anniversary
Oh,
in
congrats.
September.
Congrats.
Thank you. It was very exciting. So yeah, 10 years later of peaceful living and we're just continuing to grow and we have like our mission, which is trying to get 1 million people helped in 10 years. That's our next 10-year target.
Oh, I love that. That's
Yeah. It's
amazing. That's
exciting.
so cool. And you train EMDR therapists too, right?
So I'm a consultant. There's
Okay.
trainers and EMDR is like a little like there's what is it like I think in pictures and I sometimes struggle to find the words to match, but like there's levels, right? So you do the basic training, then you can become certified, then you become a consultant in training, then you can become a consultant. And if you
Okay.
want to train others as well, you could do that too.
Oh, okay.
So I'm not a trainer yet. Basically, that just means I don't do the basic trainings. But as a consultant, I work with EMDR therapists who need consultation, who need more experience practicing using EMDR and
Right.
like really refining their skills. And that helps them be a better EMDR therapist. It helps them integrate all what EMDR therapy is about into their daily practice.
Oh, that's so great.
Yeah, that's
Yeah,
wonderful. It's
love it.
interesting. So I know you had a mentor that you mentioned that sort of brought you into this field. How do
Yeah.
you find other therapists that might be interested, or what drives them to be interested in going into this type of therapy?
Yeah. I mean, I think it's really now more it's more popular, it's more mainstream. So, things like when Prince Harry came out and talked about how he did it, and um, Lil Jon just did a whole thing about how he did EMDR. So I think that's how a lot of therapists are finding out about it. Plus, it's more talked about in the field of,
Hmm.
um, this is a really groundbreaking approach that really helps people actually get results.
Yeah.
Yeah.
So I think that's how people are really finding, how to get trained in it. And then once they do the training, most EMDR therapists, when they first do the training, everybody's terrified. They're like, oh my God, I don't want to kill a client. And a lot of like the beginning of consultation is reassuring them that that's not going to happen and just
Right. Yeah.
kind of, yeah, and helping with the conceptualization of everything.
I can
Okay.
totally see that because it is like your brain. So I get that.
Totally.
Yeah.
Totally.
So,
Yep.
and
Okay.
let's back up for a second too, like just for any listeners that may never have heard of EMDR, can you explain what exactly it is?
Absolutely. EMDR stands for eye movement desensitization and reprocessing. So, the easiest way to explain it is that it focuses on what happened to you, not what's wrong with you. And so, the lingo for that EMDR uses is adaptive information processing, and that basically looks at your symptoms that you struggle with. How are they actually adaptive? How are your symptoms solutions? And solutions to what? What was going on in your life that your nervous system had to adapt in that way in order to survive?
Right.
So when you can really zoom out and see that whole picture of symptoms as solutions, then you can really say, well, here's what happened to you that those symptoms came to be. And that trauma informed approach really helps kind of understand the entire picture of someone's inner experience.
That's cool. I love, symptoms as solutions. And we see
Yeah.
that in, whoever we're talking to, whether it's a chiropractor or somebody else, your body's always trying to protect you and keep you alive, right? And make you keep
Yeah.
going. So when you have a symptom, it's your body speaking out to you. And it's the same in
Absolutely.
this field as well. Yeah.
Yeah. I mean, we all learned in like sixth grade science, right, about homeostasis. Like the
Hmm.
Hmm.
system is always trying to find balance.
Yeah.
And that's what our nervous systems do. They're always trying to find balance. And so we can kind of say, okay, well, how is this symptom the answer to something that was going on?
Right.
Right. Right.
Yeah.
Right. And so I think a lot of people are always like, what do you do with the eyes and the eye movement? What exactly does the bilateral stimulation do and how does that work?
So there's a lot of different theories on what the bilateral does. So, like the kind of older understanding of it was it integrating the left and the right hemispheres because bilateral, the left side of your brain controls the right side of your body and vice versa. Now, with some of the like newer research, it's all about taxing the working memory. So, a lot of times when you have to do like two things at once, so to speak, so focus on this distressing experience while either tracking these eye movements or feeling the tactile buzzers in your hand, that kind of split attention helps decrease the intensity of the overwhelm of something. So instead of hyper focusing on it, where you get overwhelmed and shut down, this gives a way to split your attention so that you can have an optimal level of arousal in order to reprocess a memory.
Wow, that's so
Yeah.
It
interesting.
really is.
It's so crazy how
Yeah.
the brain works like that. And
Yeah.
what are some different ways that you do bilateral stimulation? Like
Yeah.
I know with
So
eye movement, but there's different types of ways too.
yep, absolutely. There's like eye movements are the traditional way, like what all the research was done on, and that's tracking either left and right or diagonal or up and down, what have you. The other ways, the more favorite way I've seen among clients are the tactile. So it could be if you don't have the fancy buzzers, I'm looking around my office to see where they are. Like these that I use, vibrate in each hand. So this tends to be a favorite. If you don't have these, that's okay. A lot of just people do tapping
Okay,
of,
yeah.
tapping left and right, that type of physical stimulation or auditory. So with having headphones and the sounds can alternate one side versus the next. But that
Okay.
helps with that maintaining that optimal level of arousal for reprocessing.
Okay, and I don't know, I could be way off base here, but is binaural beats a form of that?
I was literally thinking that as you were saying it. I was going to say it's kind of like binaural beats, but I don't know like if anyone could understand the context. But yes, it's very similar.
Okay, cool.
Yeah, because binaural beats is more like different frequencies in each ear, and
Yes.
that helps again with that like perfect frequency for you. That can help like fine tune your focus, your attention, what have you.
Right, right. Oh, it's so crazy. I love that how that works. And
It's really neat.
do do all clients respond the same way to different types of ways that you do
Like
that?
bilateral, that's a
What's
great
wrong with me
question.
today?
Yeah,
Oh,
I, it's just one of
sorry.
those days. One of those days. Everybody responds differently. So some people like the tactile, some people like eye movements. I tend to have my own approach that I will tailor to each person depending on what works best for them. But I'll usually use the tactile for the resourcing, the like stabilization parts, and then do two m- modes of BLS. So I will do like tactile and eye movements when we start working on distressing experiences. Um, but that being said, some people who like maybe have difficulty focusing prefer just the tactile so they can close their eyes and really focus on their inner experience.
Right.
So yeah, everybody responds differently, and that's the beauty of everyone's neuroscience and everyone's brain being magically unique.
Yeah, it probably varies upon the experience maybe too.
Yeah, absolutely.
Yeah.
Yeah, it sounds, I mean, I know what it is. It seems like it could be intimidating to some people, maybe, right? And they get a little bit nervous about it. So I was
Yeah.
wondering, typically out of the first session, would they have some sort of response, whether it's very mild or something significant, either way? Or does it take a few different times visiting to really start to see any effect from it?
So what we do at our practice is we have like our proven process. So we say it takes 1 to 3 sessions whenever you start to even before we even go near these,
Yeah.
near the buzzers. Our process is 1 to 3 sessions to really understand the nature of the symptoms and what the goals for treatment are. Then when we've determined, okay, after that third session, we have an understanding of what the goal for therapy is. We've created a treatment plan. Then what I'll usually do is I'll say, okay, let's just see how these feel for you. And I'll put them in their hands before we even do anything to say, like, this is what it feels like. Cause I'll usually get what are you trying to electrocute me? Or what is that? Like those like funny things. So I'll introduce it in that way just so they can get familiar with it
Right.
before we actually dive right in.
Okay,
Okay, great.
cool.
I know when she tried it, definitely the first session had an impact,
Yes.
right? So, and
Yeah.
we found it to be extremely exciting.
Yeah, it was.
Yeah.
It is very exciting. And for someone too who's thinking about doing EMDR, can you walk us through kind of like what the experience would be like and what would happen as they go in for a session?
Yeah. So, I mean, the biggest thing that's important with when anyone is deciding if they should do EMDR is really they have to decide what they want to get out of it. That's something I'm super passionate about because that everyone's experience will be uniquely different based on that.
Right.
Hmm.
So then their first session will usually be I always start with, after we've done those 3 sessions of really creating the treatment plan, I will always start with a resourcing stabilization exercise to promote, give tools like for emotion regulation, being able to create positive resources that might not be in that person's frame of reference
Right.
so that when we start reprocessing distressing material, they have tools and resources to connect to that can help them in that moment. Without those things, we're just going to be going right into distress again without any support system, and that could be re-traumatizing. We don't want to do that.
Right.
Yeah. And is it through that process that you sort of identify what memory or what trauma it is that you're going to address? 'Cause I'm sure people have tons, right? And a lot that we
Yeah.
don't even know about.
Yep, absolutely. So the phase one of EMDR is the history taking process. But that being said, I always, especially I do a lot of work with complex trauma. And so even that can be very destabilizing for someone. So a lot of times we start first with resourcing to regulate the nervous system before we do the float back that we call it of, okay, now let's think of this symptom that you want to work on. Now let's close your eyes, notice that symptom where you feel it and float back to an earlier time in your life where you had that same experience. And because there can be so many things that someone comes up with, we will create like a list of potential targets. And we go like, okay, now don't go into the details when I ask you to float back. Just if that memory were like the name of a movie, what would it be called? And about how old were you? And I write that down. Okay, now float back from there. And what would that be called? So we make a list of potential targets. And then from there, we decide what's our reprocessing approach. Should we start with the, like we call it the touchstone memory, which is like the core root? Or should we start with something more recent? Because for some people, going to the root right away might be way too destabilizing. So
Yeah.
we do what's called the tip of the finger strategy, where we start with something more recent, desensitize that first so that that individual has a sense of how the process works without it being so overwhelming
Right.
before we go back to the earliers. But usually we can make that list of potentials and then we kind of phrase it as first, worst, most recent,
Okay.
and make a decision between therapist and client together about what the approach will be.
Okay,
Right.
that's really interesting because that's one thing too that was kind of even difficult for me. Well, for one memory I knew, but then, for different to kind of combat different things such as like why am I an overthinker, or why would me be a people pleaser or something like that. It
Right.
was hard to identify the exact memory
Right.
because I was like, here's some memories but I don't like really know, and so that's really interesting. That's a really nice sequence of events that you have to kind of get there, and I
Right.
love how you make sure that the client has the tools that they need, just
Right.
because you don't know how you're going to react.
Right.
That's the
Right.
one thing too about EMDR is I've seen people, they'll like on Reddit or something asking, can I just do EMDR myself? And it's like, no, because you do
Don't,
not
no.
know how
Be
you're going
careful.
to.
Yep.
You
Because
can
what
be the
I always,
strongest person ever. You don't know.
exactly. And like my favorite thing is when, someone calls and they're like, okay, I want EMDR for this memory. And I'm always like, that's cute that you think that's what the
Yeah.
memory is, because what
That would be
human
me.
beings, right? But what we are, and sometimes they're right, right? Sometimes that is what is feeding the present day disturbance. But what human beings are amazing at, and it's also our downfall, is we love to assign a narrative. We love to say, like, find the why. So we come up with this whole story that sounds great and it's totally logical, and it is absolutely not true at all.
Yes.
That's why
I
with EMDR, we do that float back,
and
because
I
when you start with the
complete
present, yep.
Yeah, and I that literally did happen to me. So you're absolutely
Mhm.
right. I went in there thinking, I was in there for one thing, and then she was like, "No, I think you need to tackle this first." From after
Mhm.
talking to me, and I was like, "Wait, what?" It was like, "I
Yep.
am first get your safety," and I'm like, "No, I'm safe." And she's like, "No, you feel like you're safe now," but like, and explained it to me, and I was like,
Yeah.
it made total sense. So I
Yes.
totally see what you're saying.
Absolutely. And especially with, like, let's say there's that person is experiencing PTSD, so their nervous system's dysregulated. So already they're not going to have a narrative that is, I don't want to say true or not true, but is not it might not be what's actually happening because story follows state. So how we perceive an experience is based on the state of our nervous system. So if we come into therapy majorly dysregulated, we're going to name all of these things that we've perceived in this way.
Mm-hmm.
That's why we need to regulate first and then do that float back, because then we can find out what are those core touchstones. Because if we don't regulate first, everything is going to be a target. Everything.
Right.
Right.
That makes
Yeah.
total sense.
Yeah, it
And
helps
when
us kind of
you,
see the forest through the trees.
yeah. Okay, so when you're going through the memories and you
Yep.
may have, or a client may have physical sensations, emotional sensations, what are some of the most common sensations that you see in clients when they're dealing with a traumatic memory?
It's a good question. I
It
don't
just
think
does
there
it just
is.
vary?
Yeah, I don't think there is a common one because everyone is uniquely different.
Right.
And I think sometimes if we try to get into language of what's common, that will definitely keep somebody in the processing, in that overthinking mode of like, is this normal? Am I doing it right?
Yes.
Instead
Yes,
of
that's
just
so
trusting
true.
the process.
Right,
Yeah.
right. Great. That's a great point. Yeah.
Yeah. Because I always tell clients, it doesn't have to make sense. We don't have to
Right.
ask the why. We just have to notice it.
I know. And that's why it's so hard for me because I'm so literal. It's
Yes, I
like
know.
it has
I
to
feel
be.
that. It has to make sense, right? But that's
Yes.
where like healing is so interesting, because a lot of times it needs to not make sense for us to be able to work through it. Like we don't always have to understand the why, because that logical part of our brain wants to come up with a why, wants to assign a narrative, but that keeps us out of feeling the feeling.
Mhm.
Right. Right. Your reaction to your thoughts, your memories, whatever it is that doesn't make sense either. So
Right.
that makes total sense.
Yeah.
Yeah.
Yeah. It's like it doesn't make sense and that makes sense.
And that makes sense.
It
Yeah.
totally does. It totally does.
Yep.
And I actually do remember too, my therapist, she was like, no, like you're going in this part of your brain, stay in this part of the brain. When I would ask
Yep.
her, because I was so
Yeah, it's like,
true.
because that's what we are hardwired to do that. And I'll explain to clients like, oh, when they this like shame comes out sometimes, like, oh, I'm overthinking again. I'm like, no, like we wouldn't have made it this far as a species if we didn't do that.
Right.
Right.
Mhm.
So even that ability to try to like to think and to figure out like that's just your brain doing what brains naturally do. So just notice that it drifted and we can bring it back. So we
Exactly.
can bring it back without that element of like shame or like I'm doing it wrong or something like that.
Yes. We don't always have to judge ourselves so hard.
Exactly.
Yeah,
Exactly. I
exactly.
always say never judge, just get curious.
Yeah, exactly.
Hmm.
Yep.
And that brings me to just another quick question is, you say we'll desensitize that part, right? And
Mhm.
so in doing that, you're not getting rid of a memory, you're not getting rid of anything that's stored. You're just changing the way that you deal with it and react to it, right? Is that sort of what you mean by desensitize? You're like finding an even ground so that you can handle it and understand
Yeah.
it and then move forward.
You're decreasing the level of intensity, the amount of like control that that experience has over you. So it's like when you feel like it's almost like a wave, if it completely knocks you down, you're making that
Yeah,
memory more small, little waves so that you can wade through it.
perfect.
Yeah.
And for somebody who may think that they want to work on a particular memory, and I know it could go another way, but
Yeah.
if they want to work on a particular memory, but they're, thinking about doing EMDR, but they're really nervous and scared about how they could react,
Hmm.
what would be some advice to give someone for that?
I just face that fear head on. Like,
Yeah.
let's talk about those fears. Like, what
Yeah.
could happen that is so terrifying? And when we make space for someone's fear, like we don't want to jump in with reassurance, like, no, it's going to be okay and stuff, because that just suppresses their emotions and invalidates them instead of getting curious about what function those emotions are serving.
Right. Which is
Yeah.
funny you say that because that's something that I've been actually working on with my children is
Yeah.
when they're like, I'm scared. And sometimes I'll be like, no, you're okay. You're safe. And now I'm like, wait a minute. No, I can't tell them they're
Hmm.
okay because
Right.
they
Because they don't
feel
feel okay in their
right.
body.
Yeah.
Yes.
So it's
Yep.
like,
I
this
do that
isn't
with
just
my
for
kids all the time.
EMDR, it's
Nothing will help
for
you like
anything
figure
really.
things out
Yeah.
more than parenting. Exactly. There's so
Right. I
Yeah,
much
know, right?
exactly.
overlap. Yeah, there's so much overlap with parenting and like doing trauma work and things like that, because we're able to see how like our old ways of thinking, how that
Mhm.
became a generational trauma almost, because like that's how like our generations before us, and then we're able to say like, okay, just being like, oh, it's going to be okay, that didn't help us, that kept us hijacked.
Yeah.
So
Right.
instead of oh, what is it that's scaring you, what's the worst thing you can imagine,
Right.
and then
Exactly.
you get them to that, like, what would happen next. Like my son, like, oh, the worst thing that could happen is that I would be scared. Okay, and then what? Because a lot of times it's not the emotion that's overwhelming for a lot of people, kids and adults included. It's being alone with the emotion that's really
Right.
dysregulating.
Yeah.
So I always tell my son,
Right.
like, mommy can't fix your feelings, but I could sit with you, with them, so you don't have to feel them alone.
Mm-hmm.
And
Right.
that's
Exactly.
the work.
That's exactly why saying, no, you're okay is the wrong thing to do
I know.
in a lot
Right.
of cases.
Right.
Yeah.
Right.
Well, it's
Yeah.
funny. It's just like I read this quote not that long ago, and it was like our generation is, we're trying to fix ourselves while we're trying to make sure that our children grow up with like regulated emotions
Right.
while dealing with our parents
Mhm.
Yes.
in
We're
their
the
older,
only generation
older.
that's like healing generations right before us and the ones like right after us. It's a
Exactly.
pretty weird
Exactly.
place to be.
It's so
Very
weird.
weird place to be. It's so
Like,
weird. Those are like things, it's like hard to put words to, but you're just like, oh my God.
mhm.
Totally.
Yeah.
Like that and being stuck in the middle of the technology and progress there. It's like, what are we supposed to
Yes.
do?
Yeah. Yeah.
Exactly.
Totally. So I'm curious, what do you think about intensive sessions of EMDR? Like
I
when you
think,
do like
yeah.
3 hours at a time.
I think that they are absolutely wonderful, especially for people who don't really have the ability to do weekly therapy
Mm-hmm.
once a week. It's a way to really say, like, okay, can you take 2, 3 weeks off of work so we can dial in and focus and then process things out? So I think that they're a really great way to help people still get the outcome that they're seeking that might fit their lifestyle a little bit better. Because for a
That's
lot of
good.
people, it is hard to just have like a weekly session, and
Yeah.
to be able to do that, it's very difficult. So instead of trying to do that, it is a way to get results a little bit faster, so you're
I
not in
think,
therapy longer.
yeah. And I'm really glad you say that because that's what I did.
Yeah, yeah, absolutely. They're wonderful. They're absolutely wonderful. Yep.
And my way of thinking too was I didn't want to get started and working on it and then stop.
Mhm.
Although I did have to for the first memory because it was a long time. I think the first memory that you're trying to process takes the longest usually. Is that true?
Mhm. It
Yeah.
depends. It depends on which, if it's the first, worst, or most recent. It depends on where that memory lies on your target sequence plan, as we call it.
Right.
Yeah.
Gotcha.
Yes. So do you have a timeline like of how often you should come in, or is that sort of up to the patient to understand how they're feeling after a session and then come in when they're ready?
Yeah, it really depends. Like for me, I don't do intensives just because my schedule doesn't really allow for it. It's I just haven't really figured out how to create that with
Fit in.
all of the other things I'm doing.
Yeah.
Yeah, but I will tell
You're only one
clients
person.
Yeah.
it's just me. Like, right, I have all my clinicians here who are amazing and they do amazing work as well. Um, but we can, like, a lot of times we'll say, like, let's do those first 3 sessions in our proven process, and then we can decide if there is like an intensive format that is better. We can see if we can create that. Like sometimes
Okay.
there's EMDR intensives and then there's doing EMDR intensively. So maybe that's a 90-minute session as opposed to, a 45-minute session. So they're still doing like getting results faster, but it's not like every day for 3 hours, in a 2-week period or something like that.
Right. That makes sense. All right. I want to play a little game.
Yeah, I love games. Let's do it.
Okay. True or false? Okay. So, true or false? EMDR is a form of hypnosis.
False.
I know that's like a really common thing people ask.
Yes. They're like, what is this woo woo that you're doing? I'm like, I can explain the science. I love science. I have no problem explaining to it. I said, but do you really want me to do that? Or are you just scared and you don't want to keep going? Yeah.
Right. Yeah.
Well, when people are doing this, do you fall into like a somewhat of a meditative state at all? Or it's
It
not
gets you
not
into,
hypnotized?
it's not hypnotized. We call it dual awareness. So it's
Okay.
the ability to have one foot in the present and one foot in the past at the same time.
That's wild. Yeah. Super
Yeah.
cool.
Yeah.
Is it like a certain like brain state?
I think if you actually probably did the the electrodes that like tested the brain frequency and stuff. I'm totally guessing right now, but it would probably be in like a theta state, which is like a
Okay.
more meditative state.
Mhm.
But I haven't actually been able to like do that. I would love to. The science behind it of like stick electrodes on someone's head and be like, let's see what frequency you're at when you're processing.
Yeah.
Totally.
Cool.
That would be very cool. I would love to put someone like on a functional MRI as we're processing so we could see that optimal level of like hippocampus and amygdala online at the same time. Like that would be very cool.
Yeah.
But yeah. I don't even know if I answered your question completely because I went
Oh no, it's
woohoo here
okay.
on the science,
You
but
got it though.
yeah.
No.
No, that was
Dual state.
that was a crazy question.
Yeah.
Okay. Okay. True or false? You can do EMDR from the comfort of your own home over Zoom.
I'm not going to say totally false because you can do it. Whether or not you should is the question.
Right.
Because
Depending
there
on
are
the
companies there that like offer it. I don't recommend it. But I think that if it is really the only option someone has, I would then maybe get clearance first from an EMDR consultant or somebody to see if that is the best decision for you.
Okay. And it could probably depend on like the complexity of the trauma.
Exactly.
Okay.
Exactly.
That makes sense. For someone that, does do it, would you say, or someone that was able to do it remotely, would you say it is just as effective as in person?
Doing it remotely with a therapist or virtually on their own?
No, remotely with a therapist.
Oh, remotely with a therapist, yes. It absolutely is as effective. That
Okay.
being said, everybody is different. So I have noticed that there are some individuals who like we were doing EMDR during COVID and stuff, and I was actually doing EMDR virtually before COVID even happened. But I did notice that once things calmed down after COVID and some individuals were able to come into the office, their progress picked up a lot.
Okay.
So there is something to be said, especially for individuals who have attachment trauma. There is something to be said for that, those mirror neurons and that energy that takes place in a shared space.
Right. Okay. That makes sense. Totally.
Yep.
Okay. True or false? EMDR is talk therapy with the addition of eye movements.
False.
I
It's
know.
so false.
It's way more than that, right?
Yeah, way more than that. And it's not a cognitive therapy, I say all the time, because a lot of times there's that, like, it's all about your thoughts and stuff, and it's not. It's about your nervous system and how the state of your nervous system impacts the story that you tell yourself.
That's great. I'm glad you said that.
Yeah. Okay, true or false? EMDR only works for people with specific traumas like car accidents, assaults, or traumatic military experiences.
False. So false. Yep. It's like known for being the treatment for PTSD. However, the EMDR approach is you can link everything back to quote unquote trauma. And even the word trauma is just overused these days, but any
I always
really
say that.
distressing life experiences, right? Like, right. Everyone's like, oh, my trauma, my trauma. And I'm like, there's Eustress, right? EUSTRESS, which is optimal levels of stress that help you build resilience over time. And then there's distress, which is when that stress response in your body exceeds your ability to cope and does not build resilience over time. So EMDR works on the distress so that you can turn that distress into eustress and build resilience.
Perfect. You explained that so well.
Thank you. 10 years of practice.
So what would you say, I know that what we just talked about, like with the, the kind of trauma that you would think of, but what are some other issues that EMDR could help out with, do you think? Like just somebody who's having a hard time with certain maybe like personality traits or something like that.
So when you think of personality disorders, right? Like individuals who are labeled with borderline personality disorder, narcissism, complex trauma is often mislabeled as personality.
Okay.
So it's really, temperament. It might not change your temperament if you're just like a very like energetic person. It's not going to change that. But if you're a hyper vigilant person that you are thinking is your temperament, it will help that because it will make your hypervigilance tempered so that you can be more intentional with that energy.
Okay, cool. Awesome. And do you, so this is kind of a weird question. I don't know if this is going to make sense really, but is it ever appropriate for children to have EMDR?
Oh my God. Yeah. Oh, ooh,
Okay.
yeah. Oh, so appropriate. Love that question. We have two rock star child EMDR therapists in our office, Lauren and Stephanie.
Okay.
They are both killer. They're so good. And it's amazing doing EMDR. You could say I get like so excited about it. Because I started working with kids as a therapist. So that's like where my like OG heart is. I just now
Oh,
have
I
them.
love
So I
that.
can't do the schedule as much.
I love that. Well, you're changing the whole trajectory of their life. So it's like so meaningful.
It's amazing because when you when you work with kids with EMDR, they have less stuff to work through, right? So it's much easier to create a target sequence plan, which is basically the present day triggers, the past experiences that are feeding them, and the desired future outcomes because they just have less experiences. They're young.
Right.
It'll
So
help
it's
them,
easier.
and it helps them build the foundation going forward on how to handle situations and thoughts. Yeah.
Absolutely. It helps them learn to tolerate distress, like
Yeah,
to turn
definitely.
that distress into eustress.
Wow. That's
What
awesome.
would be the youngest person that would be able to handle it?
So they're the youngest that they'd be able to handle. I mean, you can handle it at any age. It's just what approach are you using?
Okay.
So if it's like someone 3 or younger where there is like PTSD, maybe there's a medical issue, you're going to have actually the approach with in the session is going to be a little different because the parent is going to be involved. And then you'll do like with the parent and the child in session and be able to do these exercises that help with like there's like the lollipop game, which is about like attunement, where imagine the lollipop is a bottle and you have to let mom know that you're full. So what are you gonna do? And like pushing it out and the mom responds to baby's cues. And you do that with the bilateral, like either in their hands or in their shoes or something like that. And that helps foster more attunement between parent and child. And so the reprocessing looks different there. So you can do it with like as young as 3.
Oh,
Um,
wow.
you can, yeah,
Yeah, that's amazing. I never would have
it's
thought
really
you
cool.
could go to somebody that young and give that kind of support. That's great.
Yeah, I mean, some of the coolest sessions I've had actually were with when I used to work with kids, which were the kids on the spectrum, because they actually have this beautiful ability to not get so jammed up in the narrative.
Hmm.
So when we do stabilization exercises and reprocessing, they can really get into it and visualize it and make it like I had one individual who made this whole like beautiful space of like the aroma room where it was like calming smells and there was like a massage room where we created
Oh,
this whole calming safe place to
that's
access that
amazing.
felt sense of where regulation could happen.
Yeah, that's
Oh,
wonderful.
that is so wonderful. I love
Yeah.
that. And do you remember the moment that you realized, like, wow, this really works?
I mean, I have that moment every day
I know. I was
still.
going to say
Yeah.
probably all the time, right?
Well, it never stops amazing me how much it works. It's just, it's, it seems like magic. And I know it's not magic because there's like scientific principles behind it. But every single day I have that moment of, damn, this shit really works. Like it's
Yeah.
so cool.
It does. And it
Yeah.
does feel like magic too.
Yeah. Well, I
Yes.
think the brain
Yeah.
and the nervous system is magic, right? I think it's
Absolutely.
incredible. So
Yeah.
why not
It's
handle
so,
it with
it's
magic?
absolutely, it's an amazing
Love
thing
it.
to witness.
So EMDR is known for like reprocessing in the brain. How
Mhm.
exactly does that work in the brain? Do you know like the process that kind of goes through, if that makes sense?
Tell me a little more like what changes happen in the brain?
Yeah, how does it kind of get a memory unstuck?
So when memories get stuck in the first place, diagram here.
Oh yeah, perfect.
So we need, in order to encode experiences into memory, we need that optimal level of arousal, that eustress, if you will. So in the brain, we have like our limbic system is our amygdala and our hippocampus are all parts of the limbic system. Now, when we go through a stressful experience and there's a surge of adrenaline, that can shut down the way the hippocampus primarily functions. So when you think of encoding a memory, you have the amygdala and the hippocampus. One gets the energy up and it gets to the activation level needed to transfer that into a memory.
Okay.
If the experience is so overwhelming, and I forget what the chemical is, I don't know if it's adrenaline or if it's another chemical, so I don't want to misquote it, but too much of it shuts down the hippocampus. So there's overactivation. So that memory stays stuck in its raw state.
Okay. That
And
makes
it's
total
just,
sense.
right. So anything happens in the present day, that lights up again and again and again. And that creates that surge of too much energy. So this stays down. This hippocampus stays down. So what EMDR does, and this is with the phase 2, the stabilization stuff, with reprocessing with dual attention, creates that optimal level of that chemical so that now those experiences can be encoded into memory.
Okay.
So it basically adjusts the chemicals in the brain, in the nervous system to be able to tap into what the brain does naturally, your brain's natural healing ability.
Right. Wow. It's so wild. The capabilities that our bodies and our brains have. It's just
Crazy, right?
It's so crazy.
I love it though.
And
It's so
it's
cool.
yeah. And
Yeah.
like the last like 2 years learning so much about neuroplasticity, I'm just like, oh, this is like a game changer.
Right? Like you can rewire your brain up until the day you die. How freaking cool is that? Like
It's
That's
amazing.
awesome.
Yeah, it's like superhuman.
It really is. It really is. It
Yeah.
makes me feel so much gratitude too. Because
Right.
when you're younger and you don't realize things, it's so great that when you move on to different chapters of life, you can actually change things. So
My grandma always said, my grandma Sally, my grandma and my dad were like these two huge forces in my life. And she always told me there's a certain wisdom that comes with age that you have those experiences like you just described where you're
Yep.
able to like all of a sudden see it and you look back of like, oh, wow.
Yeah.
Yep.
Yeah.
Going through a lot of that lately.
Yes.
Yeah. That's the good thing about aging, right? With age comes wisdom.
Exactly.
Yep.
And so with the nervous system, like how does EMDR help regulate the nervous system, like especially for people who are living in fight or flight all the time, which used to be me?
Mm-hmm.
Yeah. So when you think of the nervous system, it's not just your brain; it's your brain and your spinal column, right? And like all of like the autonomic nervous system, parasympathetic nervous system, all of those. So think of like when you're feeling super anxious, what usually happens in your chest, right? Your heart starts racing really fast because the brain perceived a danger and then sent a signal to activate the sympathetic nervous system to make your heart start beating really fast to give you enough energy to fight back or run away. What EMDR does is able to like accurately assess using like I use the word discernment a lot to discern if that is an actual threat in the present moment. And this all happens in an automatic way. It's not something you have to consciously think of so that your brain no longer perceives a present day experience as a threat. So then that sympathetic nervous system doesn't get activated. Your heart doesn't start racing and so forth.
It's just
So
like
it takes those present moments and stops them from becoming threats over and over again.
Yeah, it's just kind of realizing this happened to me, but this is not happening right now. And,
Right.
I just like trying to look at it from more of like a neutral point of view rather than like what was actually happening in that moment because that moment's over.
Right. Because the brain doesn't store memories as like categories of like, these are all my 10-year-old memories. The brain, like neurons that fire together, wire together. So it creates memories based on association. So anytime there is a thread of association, like it could be the smell of like a cologne that you smell in the present from like the checkout guy at like A&P or something, that was the same cologne that your father wore who used to abuse you. And all of a sudden your heart is racing and you don't know why you're so dysregulated. And then we come up with a reason why, right? We're like, well, I'm anxious because like I have my period, or I have like I got my husband's being an asshole. Like we come up with all these reasons. Like we're so good at that. But really it's there was a trigger I didn't even notice. And that's a
Yeah.
big part of EMDR is really unpacking those triggers first to create those moments of when that activation first took place, what was going on. And then it's like a question and answer, like, where were you? What did you see? What did you smell? Like all of that, because those senses are what connect to those associations, which then connect to a distressing life experience that might be unprocessed that triggers the whole nervous system to go.
Yeah.
Right.
Oh,
Right.
it's funny you said that because I was just thinking triggers when you had started that.
Mm-hmm.
It's exactly it. So it
That's how
sounds, I
triggers
mean, it's,
work.
yep. Then
Yeah,
it's very much like it's mindfulness, right? Being able
absolutely.
to kind of see what's coming in, observe it, not judge it and deal with it, but you're doing it on a much deeper, more important level, but very
Absolutely.
similar, right?
Because you can observe it. And the next part with EMDR is like Dan Siegel always says, insight isn't always the answer. You need insight, that mindfulness is the first step. But
Hmm.
then now that you know it, now you have to give yourself space in a therapy session to be able to feel the feelings that you did not get to feel and process in relation to that experience. It's like a completion process.
Right.
Yeah.
So
All
when you
right.
give
That's
yourself
awesome.
space, it
Yeah.
processes it. And then that's how you know, okay, that's over now. You no longer get
Right.
triggered in the present moment.
And are there any like signs that somebody could look out for to know like, okay, after they do EMDR, oh, like signs that your nervous system is healing?
Yeah.
Just kind of
So,
not getting those reactions, I guess.
well, a lot of times I'll tell clients, like, even though it seems counterintuitive, you know it's working when you start feeling worse first,
Yeah.
Yeah.
because that's all of a sudden you're actually like tapping into what's been ignored for so long. And I'll always say that with like an asterisk, because yes, you're going to feel more uncomfortable. However, that's why phase 2 is so important, because you shouldn't be so uncomfortable in between sessions that you are completely decompensating and shutting down.
Right.
That's why phase 2 is so important, because you're going to have that discomfort. So here are the things to help in the moment when those things happen in between sessions. And that practice in between is also building up those emotion regulation skills to tolerate the distress that comes up in the session. So it
Mhm.
all works together.
Right. It's all
Right.
connected.
I think it's
Yep.
really important to understand too that it takes time and it's going to be hard and it's a big challenge
Right.
because these are things that have built up over a long time. And
Right.
it's, similar to physical ailments that you may have after, 20 years of eating fast food, right? You can't just fix it overnight. It's going to take
Yeah,
some time and some effort to get there. But
absolutely.
don't
Like
be
I just
scared,
said,
right?
right. Or like be scared and do it anyway, right? Like be
Right,
brave.
exactly.
That's what I always
Yeah.
tell my son. I'm like, it's okay to be scared. Don't let the fear stop you.
Right.
Like fear is, I always like give the description to clients that fear is a mobilizing energy. It's actually really helpful when we can look at it as how is it's adaptive. Like my husband once was like, oh my God, I have to go to this like neighborhood. He's a real estate agent. He's like, I have to go to this neighborhood that I'm a little concerned about. And I was like, good, I'm glad you're scared, because that mobilizing energy is going to make sure you either fight back or run away so you come home to me alive.
Yeah.
Right. Yeah.
It's true.
Right? If you have no fear, you're going to walk into like a lion's den and get killed. Like,
Yeah.
so when we look at that fear as adaptive, so I'll tell my son it's okay to be scared. You can use that fear, that mobilization to discern if you need to fight back, run away, or learn that maybe that fear in that moment, like, okay, I can overcome that. That's
Right.
how
Right.
we learn to tolerate emotions.
Right.
Yeah,
Right.
exactly.
Yeah.
Yeah.
That makes total sense. And
Yeah.
so after somebody is kind of done reprocessing a memory, how do you know if they're done for sure?
So we have rating scales built in. When we do like the standard protocol, there's something called the SUD, subjective units of disturbance. So we'll say, well, now when we look back on that experience that we've been working, how much of a charge does it have to you? Now, 10 is the highest disturbance you can imagine, and 0 is none at all. The goal is to get to like a 0, or we call it like an ecological 1, where like who wouldn't be disturbed when they think about something that happened that was disturbing.
Right. Right.
Mhm.
Um, so that's how we know that that past memory is done. And then from there, we have to desensitize the present day trigger and then install the future template. So when we work through the 3 prongs that EMDR works on, past, present, and future, that's how you know you're done.
Okay.
I assume somebody could be a lifelong student of this type of therapy, right? I mean, there's always something that you could be working on and improving upon.
Not really.
No?
That's where I'll challenge you. So, like,
Okay.
there's always going to be stuff that's challenging, but good therapy gives you the skills to tolerate it
Yeah.
yourself and also say, like, it's good enough. It doesn't have to be this, like, there's always something to work on. This is good enough. Like,
That would
we
be
all
Yeah.
kind of get,
exhausting.
Okay.
yeah, like, it to always have something like, I am a recovering perfectionist. So, like, I'm very aware of how much of a trap it can be. But it does get to the point where you can say, like, how much is enough?
Right. So
Yeah.
you've dealt with some things, you've learned the process, you've sort of rewired a little bit. And so that's enough. Now I'm good to move forward.
Right. Well, now
Yeah.
it's my
Right on.
system is regulated. My nervous system is regulated enough so that when distressing things happen, I can handle it the way I want to handle it. And that's what the future template part of EMDR is all about.
Mhm.
Right.
So when we work through we cleared out the past, we desensitize present state triggers. Future template is okay. Now imagine that trigger happening in the future, and then visualize yourself handling it the way that you ideally want to handle it. And it creates an experience, like a visual experience of handling it the way you want to handle it. And the more we install those, the brain doesn't know the difference between if something's actually happening or if you're just imagining it.
Right.
Mhm.
So even those, visualize yourself handling it the way you're handling it. That gives you the confidence so that when those things do happen in the future, you're like, okay, I've done this already. Like
Right.
my brain knows how to handle it this way. And it's kind of like riding a bike.
Yeah.
Kind
Yeah.
of just go back. You start riding it just like you've practiced.
Right.
It's so powerful.
It's really
Yeah.
powerful.
Right. I think so much of
Yeah.
like what's helpful, I think for your listeners especially is not just but like me as the therapist says how it works, but also what it felt like for you.
Right. Right. Yeah.
I say after she did the couple sessions, I could tell, like, you could see it physically. I could tell by the way she was thinking and talking,
Yeah.
sleeping. Right. There was
Right.
definitely a profound impact after going through those.
Oh,
Yeah.
absolutely.
Yeah.
Totally.
What was your like day to day like? I think that's probably like because it's always the little moments that people don't realize are so
Yeah.
impactful. Like, how is your day to day different?
Oh, I'm way more laid back about things. Like,
Yeah.
about 2 years ago, I started getting some health issues, and I was like, I don't understand this. I have been like a holistic, crunchy person for like 20 years before it was even
Right.
like a cool thing.
Right.
And
Before the
so,
term crunchy came to be. Yeah.
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 And so I'm like, how did this happen? And I always thought like I handle stress so well
Mm,
because I powered through and worked through
right.
pressure. Like now I've realized like, hey, you weren't handling stress well in your body. And so that
Yeah.
was, I realized that my physical problems came from high cortisol. And so
Yes.
that became my journey of learning about the nervous system and regulation. And I always say like, I'm kind of like a guinea pig for wellness things or
Yeah.
anything to better myself. And so EMDR, I was really interested in doing for a long time.
Yeah.
And I finally did it. And there's three things that have made a very big, out of like probably 15, three things that have made the biggest differences for me is EMDR and then somatic exercises
Hmm.
and neural spinal analysis, which is like a form of chiropractic.
Oh,
But
as what is it called? PDX or something like, my chiropractor does it too, where you can actually
yeah,
do the whole scan and see what's
it's,
happening. If there's like in C1 to C3, the vagus nerve, if it's impinged, that's going to affect
yeah,
your
yeah,
nervous
it's
system as
wild.
well. Yep.
Yeah, and not a lot of people know about that because it's not like very common. But
Hmm.
yeah, those three things have helped me so much. But yeah, it was all just trying to
Heal.
bring the nervous system to a regulated state, not
Yeah, but
having to like,
you bring up such an important point because you were like, I was just good at managing stress, right?
Yeah.
And that's where I see a lot of people get stuck, especially these, high functioning, high performers. They perform so well because yes, they have adapted to being able to function with high levels of stress, but there's not enough decompression time.
right.
So
Yeah.
without that, without having moments to actually sit back and process, that cortisol level can't come down
Exactly.
and reset itself to baseline.
And nothing can change until you get that cortisol in your nervous
Yep.
system regulated either.
Exactly.
It's just always going to be
Exactly.
underlying. But another
Exactly.
thing too is, I've always been in kind of a chaotic environment. I have a very, very big family, and I lived in New York City, for a while.
Yep.
I was just really liked chaos, I guess. I
Mhm.
never realized that.
We prefer what is comfortable for us. Even if we know it's distressing, we will always choose comfort over what's best for us, quote unquote.
Yeah. And that's wild to me.
Yeah.
But yes,
You
so
have those moments, right? Of like I noticed it in my own journey too, of like, I am literally stepping in, doing things that are going to cause more stress. I'm like addicted to my own stress hormones.
yeah.
Yeah.
Yep.
It's so
Yeah.
weird how that happens. It's just like kind of like what you were saying earlier. Your body is just kind of looking for what's safe, and
Exactly.
instead of overcoming it, like that's what's safe. Because that's all you know.
Exactly.
Yeah.
Exactly. Yep. And there's
With
safety in
age
what we
comes
know.
wisdom
Yeah.
There
and
you go.
awareness, right?
Yep. Absolutely. Absolutely.
And so after you go through the memory reprocessing, that is when you start to kind of figure out something to replace that memory with, right?
So it depends on because you're not really like replacing a memory. You are um, changing the way that memory affects you in the present moment. In some cases, because there are like more overt traumas, and then there's traumas by omission. So the things that didn't happen to you but should have. So like having a nurturing, caring figure to help you process an experience. So we might use more of an imaginal nurturing to quote unquote rewrite a memory of, that thing that happened to you. Let's invite that nurturing figure into that experience and imagine yourself having them with you. Go with that. So
Okay.
that will change the way the memory impacts you in the present because it's giving you something you never had before.
Right, right.
And
Yeah, that makes
yeah. So we're not like changing memories, but we are changing the way they impact us.
okay.
Yeah.
Perfectly said. And
Yeah.
is there anything that you do, like any suggestions that you give, like after EMDR, just to kind of help support the whole process? Because I know it still is. There's still changes happening in your brain after you're done with the therapy or done with a memory.
Right. Yeah. I mean, that's something I give all my clients like this kind of like packet of like what to expect before, after all of that. Um, Time practicing all of the tools from phase 2, resourcing helps again with integrating the changes that are made in your brain, like doing all of that stuff. And I tell clients even when they graduate, because the goal, like my clients know you come in and my goal is to have you graduate. Love you to death. However, I don't want you to need me forever because that's codependency. That's not therapy.
Right.
So I'm like, the goal is to have you heal. And then if you graduate and you like something feels, give me a call. We can always have a tune up session or a check in. Like I'm not going anywhere.
Right. Right.
So you could always reach back out. You don't have to like figure things out on your own constantly.
Yeah.
So just knowing that resource is there is helpful.
Oh, totally. And do you have any, are you, and something too, do you ever do this? Like when I did my EMDR, I don't want to keep bringing it back to my EMDR because I know
No, I
everyone.
think it's helpful that you do though, because you have firsthand experience of how it works.
Yeah. I was just wondering, like, for when after it, she was like, if you have any issues, think about it, like make sure you're aware of it, and do kind of like the tapping.
Mm-hmm.
And I did have to do that one night. I
Yeah.
actually, because the issue that I was working on was safety, and I actually like went to bed that night. I put root chakra music on
Love
and
that.
fell asleep and woke up like something with that music or something like triggered something, and I was like, oh my gosh, like I felt like really weird. And so I did that tapping, and it brought me back down, and I just was like, I'm good, I'm safe, like everything's all
Yep.
good.
Yep.
And
It
so
helps with
that
that
helped.
integration. Yeah, we call it the
Yeah.
butterfly hug is something we teach for clients to use in between sessions. So that's just this left, right tapping to help.
Yeah.
Yep. Like if you ever see kids sometimes, like if you can tell they're upset, they kind of like go side to side on their feet and they
Mhm.
sway. That it's the same thing. We're just kind of reorienting or getting both hemispheres of our brain online to help stay present in that optimal
Right.
level.
It kind of reminds me of too, like we rock babies.
Yep.
I always thought of that as a
Exactly.
somatic thing, but you are going back and forth.
Exactly. Yeah.
It's awesome. And so is there okay, so this is definitely something that is wild to me that I want to ask you about. I know it's really common if you Google about after you have EMDR, a lot of people have very intensive, vivid dreams.
And you did too. Yeah.
Yes.
Yep.
Yeah. Big time.
Yes, that is such a thing.
And you could remember them too. Like it was something that was there. Like it was an intense dream that you did remember.
Yes.
Yep.
Well, for longer than I would a normal dream.
Right.
Like sometimes, you wake up and you have a dream and you remember it and then like almost immediately you forget it. This I would remember maybe for a couple hours, but I started writing it down.
Mm-hmm.
But I mean, this was insane.
Yeah.
And I Googled it and that's how I found out it was common. Do you know like your brain, what is your brain doing?
Well, the eye movements really mimic rapid eye movement. That is what our brain does naturally when we sleep. So rapid eye movement, REM sleep, is really the dreaming phase of our sleep. There's REM sleep and then there's delta sleep that's more like deep restorative where we don't remember dreams and stuff. So EMDR taps into that. So because we are moving the eyes back and forth or doing bilateral, you're doing more of it when you sleep. So you're actually processing things now that you didn't process before. So the vivid dreams are ways that your bodies can, like we always say, processing continues outside of the session. Because once we turn that mechanism on, it can keep going. And so that's really how like your brain like downloads information, connects it to things. Like dreams are so interesting. They're not evidence-based. However, when we unpack of like what the things in the dream symbolize and stuff, we can really see how it connects to what we were working on. Yes. And it's your brain trying to come up with a story to digest that experience.
Yeah. I thought that was wild because the first time, and remember I did the intensive therapy. So after the first one, I had dreams for maybe 2 nights. And I don't even remember what they were now. This is like probably 4 months ago. And then after my second one is when I wrapped up that first memory and then also did another memory. And they just stopped. I've had dreams every night for like a month and a half.
Oh, wow.
Yeah. And I had dreams, I think this is pretty common. I know people don't usually have dreams about like their parents or their husband, even their kids. Because that's always so kind of weird because you're like, this is my life. Why am I not having dreams about them?
Right.
But I did. I had like just neutral dreams about my parents. Carl was in my dream is just like what he is in real life, like my husband, my teammate. I had a couple weird ones with about my kids and keeping them safe, which was interesting. But then, and I'm like, I'm sorry, I already told you this, so don't get jelly. But I had
no comment.
I had some ex-boyfriends, even like people I never think, like no offense, never think about, like don't care about,
right?
And had dreams about them, like multiple dreams, and I was like, this must be symbolizing something for me in my life, I guess.
Right. Well, a lot of times they say who you dream of is not that person, but the part of yourself that it's representative of. So if it's, like your husband comes up as, he's your teammate and stuff, that's helping you connect with your own inner advisor of this person that you can trust. And it's symbolizing that felt sense of safety that you have inside of you.
It's awesome. I love that. I thought that was so interesting how that happens. And I love how you connected it with the REM because I didn't even think about that, but it's like makes total sense.
Yep.
I love that. I love that perspective though. Not really who you're dreaming of. It's how you were at that time, like what you were going through, what you were as a person.
Exactly. They usually say like someone you dream of is usually representative of a part of yourself.
Yeah.
Got it.
Yeah.
It's not about the boyfriends.
No, I already know that.
Yep. It's not about them. Carl feels a little better about that though.
Feel better now.
Definitely not. Oh my gosh. No offense to anybody listening out there, but those are what was I thinking moments.
We've all been there. We have all been there. We call it like it's a learning lesson, right?
Yeah.
Yes.
Yeah.
Yep.
Okay, so I just was wondering, like, maybe some good questions that somebody could ask an EMDR therapist when they're thinking of like trying the therapy.
Yeah, I love this question. I will always encourage people to ask more questions for the person of, do you have experience treating XYZ, whatever that person is seeking like help for? So, because there are different approaches with EMDR depending on what the symptom is, or what the special population is, like first responders, athletes, like all of that is really important.
Mhm.
So ask them what their background is helping for that specific issue, and special population that they might fall into. Um, and you can always ask, like, do you have a process for how you do EMDR? Like, we have our proven process of 5 phases. So, how do you typically conduct EMDR? What is your process? What things do I need to know before I get started? What are some things to help me outside of the session? Because there are people who say they do EMDR therapy, and, without wanting to like push down some of my colleagues, there are people who don't really do it well.
Yeah. Right. Yeah.
Um, so I think asking those questions are really helpful to making sure that they have, we call it, like, the right person, and that's the right person for the right seat. You want the right EMDR therapist in that therapist chair to help you.
Right.
So asking those questions makes sure that they are the best person to help you on your journey.
I was wondering that too, because EMDR has gotten so much attention in the last few years, which I'm so happy about. But
Right.
with anything, some people kind of want to jump on the bandwagon. And so there's certain trainings you probably want your EMDR therapist to have, right?
Right. Right. And sometimes it's not just about the training, but also like an understanding. You want to actually assess like how regulated your therapist is.
Right.
There are some therapists I've seen who will take every training known to mankind because they're so hyper vigilant and they want to learn, but they cannot regulate their own nervous system, so their clients go nowhere.
Right.
Yeah, it's a
Do,
good point.
Yeah.
do people have to do EMDR training, or do they have to do EMDR during their training to kind of experience it?
Yes. So there's in the EMDRIA approved basic trainings, which are really the only ones I can speak to. But the element of it is, there has to be 10 hours of consultation as part of the basic training. But also, one of the things that you do in the sessions with your colleagues is they pair two therapists together to practice it on each other.
Oh, that's great. So
So
you know how it feels.
exactly. And they'll usually say, don't pick like the biggest, like the touchstone. We don't want to work on those because we don't want to dysregulate anybody to the point that they can't stay attending in the training.
Right, right, right.
But to pick like something mildly uncomfortable so they can really get some experience of what it feels like.
Right. Okay. That makes sense.
Yeah.
All right. Awesome.
Yeah.
Okay. So, all right. I just want to ask you some fun questions.
Okay. I love fun. Yep.
So, what is a nervous system ritual habit that you have that has to do with beauty?
That has to do with beauty. Tell me more. Like what
Like something
what
like
what
maybe
constitutes as beauty?
like maybe something like face massage or gua sha or something like that.
Well, one thing I do every night before bed, it's like part of my ritual. Maybe it is resetting my nervous system without me even realizing this. I wash my face every night to take my makeup off. And that really gets my system ready for power down mode, as I call it.
Yeah. Or like
Um,
cold water too, right?
yeah. The biggest thing I do, like beauty wise or whatever you want to call it, for nervous system health is exercise. That to me is so impactful. I met my husband in the gym. So it's
Oh,
something
I love
that,
it.
yeah, it's definitely something that we are both passionate about, because again, it's not, I don't give a crap what my body looks like and stuff. Movement is that's that somatic element that helps us process things.
Mm-hmm.
So, that's how, like, if I have a really like stressful day, I need to like take a medicine ball and smash it on the floor to relieve that pressure that's built up inside my body.
Right. Yeah.
Yeah,
It's
definitely.
getting all that tension out.
I think too,
Absolutely.
like even washing your face it's a regulating activity if you do it routinely every night. And that's what it is
Yep.
that sends
Yeah.
you off into a better place before bed.
And
The
sometimes it's
brain
just
makes that
simple.
association
Right.
of this is the precursor to getting ready for bed. So that association, your brain will start downshifting.
Right. Yeah.
Yeah.
That makes total sense. Sometimes it's a simple things. It doesn't have to be like something crazy or trending
Yeah.
or anything like that.
No, not at all. Yeah. It could be the simplest things that we're already doing. It's just
Right.
noticing that that's the function it's serving.
Exactly. Awareness.
Yep.
So that is probably the way. So that's probably what you do to regulate your nervous system pretty much is exercise, the biggest thing, even outside of
Exercise is
beauty.
definitely, yes, exercise is the biggest thing because I'm a bitch if I don't work out. I'll be the first to admit it. I am just like that pressure lives inside of me and I need an outlet for it. So that is definitely a very big part of regulating myself.
Totally. Okay, let's play this or that EMDR edition.
All right.
Okay. Ice roller or heating pad?
Oh, see, I have that. It depends. I would do a heating pad if I was in a state of hypoarousal. So I needed to upregulate. I would do an ice pack if I was overactive and needed to calm down.
Yeah, exactly.
That's
Love that.
great way to put it. Yep.
Somatic shaking or breath work?
Somatic shaking.
Candlelight or sunlight?
Sunlight.
Silk pillowcase or weighted blanket?
Both.
I knew that was going to happen.
Me too.
Yep.
The silk keeps my hair intact and the weighted blanket keeps me grounded.
Yep. Morning meditation or night journaling?
Morning meditation.
Red light therapy or blue light glasses?
Both. Both serve different functions. The blue light protects my eyeballs like they're doing right now. The red light is helping to calm myself when I need it.
Yep. Boundaries with family or skipping the gathering?
It depends on how the family reacts to your boundaries.
A very good point.
Sure.
Very good.
Yep.
Big breakthroughs or slow and steady shifts?
Slow and steady shifts. Because I think there's the misconception that there's going to be this huge, big breakthrough. And that does happen, but it's not always. It's usually the subtle shifts that you just have to pay attention to.
Yeah, I agree with that too, based on my own experience. Totally.
Yeah.
So where can everybody find you?
So I am in Scarsdale, New York. That's where my practice is. They can find me online by going to our group practice website, which is peaceful-living-mental-health-counseling.com. They can also find me on Instagram, TikTok, YouTube at _EMDR_coach. That's where I put up lots of content about like psychoeducation on EMDR, tips and tricks and things like that. So that's where everybody can find me. And everyone in my practice as well. We have 7 clinicians here who are all EMDR trained, and they're all equally amazing with their own specialties, eating disorders, athletes, children. So everyone here is more than equipped to help anybody who wants to get better, wants to heal.
Oh, I love that. And it's also good to just have a little bit of a reminder for everybody. We're gearing towards the holidays.
Yep.
And so it's just good for everyone to know that this could be a potential option that could help them get through the holidays with any triggers that they might deal with.
Trigger season coming up.
Yeah.
Yep. Absolutely. Absolutely. Yes, it is definitely high trigger season. Yeah. So some ways to help desensitize those triggers so you can function in the present moment.
Yes.
EMDR can help with that.
100%.
Yeah.
I really enjoyed talking to you today.
Thank you. I love talking to you guys.
Yeah, it's somewhat new, but it's so exciting.
Yes,
it is. Thank you so much for having me. I really appreciate it.
Thanks so much for listening. If you'd like to follow along with us, you can find us on Instagram at CrunchyPod and at Unapologetically Crunchy. We have the same handles on TikTok too. And check out our websites at crunchypod.com and unapologeticallycrunchy.com. And if you have some tips and tricks you'd like to share with us, feel free to DM us or contact us on the website. And one more thing, if you love our podcast, please consider sharing with every single person you know who would love it. And leave us a review. Oh, and you can tell them to leave a review too. We are so beyond grateful for your support. Thank you so much. Peace, love, and crunch.